Okay, so up here still on Wimbledon Common, still a gorgeous evening. And we've got another example here of a tree with a fungal infection on the leaves. Okay, so another type of question that we might want to know is, what is the prognosis? What's the prognosis for this tree? Okay, how likely is it that this tree is still going to be around, it's still going to be alive in, let's say, 5 or 10 years because of this condition killing it? You can see this tree beside it. It's obviously gone the wrong way and it's copped it, really, isn't it? So how long is it going to take for this other tree to do that? Or what proportion of these two trees will end up dying in 5 or 10 years? It's having a question about prognosis, and we think in dentistry about the prognosis of teeth quite a lot. So for teeth that have been affected by periodontitis, say, and have got hardly any bone around them, we might be wanting to know, how long are they going to last? What proportion of those teeth will still be in the patient's mouth in 5 or 10 years, assuming that we're treating it well and we're doing all we can to help it. So that's a question about prognosis. And the type of studies that we might use for that are cohort studies usually. You could use the randomized controlled trials and just follow up and see which ones that receive the best treatment, which ones actually survive, how many survive for 5 or 10 years. That's to some degree a question about prognosis as well. But quite often prognostic questions are answered by quite long-term cohort studies that follow people that have got a particular problem, or in this case, we'd be following this tree and lots of other trees like it to see what proportion of them survive to 5 or 10 years.